where we expected to see an increase, if we were going to see one, from the Memorial Day activity, and then also from our gatherings downtown. And in fact, we have seen an increase. The average number of cases, positive cases reported daily, is higher now than it's ever been since this thing began. And I think that reflects at least three things. Number one, the demand for testing has increased, and we are doing more testing. So as you do more tests, you're going to find more cases. However, the percentage of tests that are positive is also increasing. So you can't just say it's purely because we're doing more tests. Back about 2 months ago, we were running about a 2% positive rate on every specimen collected. From May 31st to June 6th, it was a little less than 4% were positive, and for the last week, it's 7.3% positive. So we've tripled in our positivity rate over the past couple of months, and nearly doubled just in the last 2 or 3 weeks. The other thing is, I believe that it does in fact reflect the fact that more people are out and about and have relaxed their social standing, so to speak, their social standards, I should say. They're not wearing masks as often as they did before, and probably huddling up a little more and congregating, and it's kind of like, summer's here and business is reopening and everything is okay, but in fact, that is not the case. On the research front, we still don't have an effective treatment for this thing. Obviously, everybody and their brother who can is working on a vaccine. There are at least 135 different vaccines in some stage of development now, and at least 16 are in some phase of human testing. You will have read about one that Dr. Fauci, has said might be available by early 2021. That is a vaccine that is targeting what's called the S or spike protein on the virus. The good news is that it appears that antibodies that develop to this spike protein are protective. However, no one has yet developed a vaccine that works in humans targeting that in the manner that this is being developed. So the one that's several are on the fast track, but this particular one, if it turns out not to be effective clinically, that could be bad in that, there's a lot of hopes pinned on it. There are other vaccines using there are multiple different biological techniques that you can use to develop a vaccine. The ones that are furthest along are using newer technology, so to speak, and not many vaccines using these technologies are in use. So my comment on that would just be stay tuned. We have high hopes, but we don't have anything that's been proven to work yet. The states around us seem to be bubbling and surging. South Carolina, North Carolina, Tennessee, Alabama, Florida, they all seem to be surging, and I'm not sure that there's anything magic about the Savannah River or the Chattahoochee River or the St. Mary's River or the Blue Ridge Mountains. And so as people from other areas come in to visit us and come into our area, they certainly can bring the virus with them. I just remind you that we are still in the midst of a pandemic, and without that treatment and without the development of an effective vaccine, absolutely the only things that we know that work are those things we've been talking about now for, since February, March. Social distancing, wearing a face mask, washing your hands, covering your coughs and sneezes. It gets a little boring to keep saying the same thing, but those are really the only tools we have that we know of that are effective. And I don't think there's any question among the scientific community now that wearing a face mask actually does help prevent the spread But I would encourage you to remember that when you wear your face mask out in public or to a meeting, it doesn't protect you from catching the virus. It protects the other people. It prevents you from giving it to them. So you're wearing it to be socially responsible and protect your fellow man. I guess for the time being, that would be all I have as far as an opening update, but I'm happy to entertain questions, and if I missed something obvious, please let me know.
Thank you so much, Dr. Davis. I guess I'll start with the first question, which would be this, is that we are open now at a worse time than we were when we closed initially. I think if you go back 110, 11 days when we were starting to look at shutting things down, and we did, our numbers were nothing like they are now. And now we have restaurants that are closing because they've had infections and a variety of other things. Understanding, again, the very precarious position you're in, what advice do you have for us as an elected body that ultimately is charged with public safety and welfare, as you are, to try to stem what's going on?
Well, we know more about the virus now than we did then, and I think early on, literally, it was the first name of this thing was novel coronavirus 2019. So nobody knew anything about it before December or January. We know that the way it spreads primarily is from person to person, either with aerosol droplets or sharing utensils, kissing, sharing saliva, so to speak. So we know that's the way it's spread. It theoretically can be spread by surface contact, and I would encourage you to continue to clean, but it seems it's much more likely to be spread by prolonged close personal contact. You're correct in that our numbers are higher now than they were to begin with, and that the economy is reopened. And with that, I think the general public, now being 2.5 or 3 months tired of trying to be socially responsible and practicing social distancing, is ready to get on with their lives. So I would encourage you, to the extent that you can, to continue to model good behavior. Wear your face mask, wash your hands, use hand sanitizer, etc. B, continue to put that message out there that this does not appear that heat and humidity have thus far diminished the contagiousness of the virus. Encourage businesses to police, so to speak, their own establishments, and if they see patrons that are not behaving in a socially responsible manner, to encourage them to do so. And I think those are the main things that, from a legal standpoint, you can do. Anything that encourages the use of face masks and encourages the lack of indoor congregation is a good thing. Moving activities outdoors is better than having activities indoors. I hope that answered your question.
It does. Thank you. Any questions from members of council for Dr. Davis? I see Alderwoman Bryan. I see Alderman Leggett.
Good morning, Dr. Davis.
Hello.
How are you? How are you? I guess you're our Dr. Foster here in Savannah. Thank you so much for your service. Just want to ask you one question. I was on your website, but I wanted you to talk to us and explain to us what community spread means, because we had asked about how do you determine and connect where the person was last when they received or they became positive. Is there something, or can you explain to us how we narrow areas? Because they said that was on your site, but I didn't get a chance to look at that. Just wanted to see if you can address community spread.
Well, one of the challenges facing all of us is reopening schools in the fall. The communities need the schools to be in to provide, not only education for the future generation of our people, but also to provide daycare so mom and dad can work. And we tried to come up with a metric or a measurement that would give us sort of a relative indication of how active community spread of the virus or community transmission might be. And if you look on, if the mayor looks on the spreadsheet that I share with him every morning, down under the big line of numbers, there is a number that's calculated, and it's calculated for each county. I'm doing it about three times a week for the benefit of the school superintendents. And it looks at the total number of cases in the last that have been reported in the previous 14 days, and we divide that by the population of the county, and that gives a rate per 100, and then you multiply by 100,000. So it gives you a rate per 100,000 people of cases that occurred within the past 2 weeks. And that's a reasonable number to sort of gauge how robustly the virus is spreading in your community. The higher it goes, the worse it is. And even though our numbers here in Chatham County, have been increasing as they have in Glenn County and pretty much in the rest of the district, compared to some other parts of the state, we still actually look pretty good. So we have more community spread now than we had earlier, but comparatively to the rest of the state, we actually still look pretty good. And I'm not sure that exactly answered your question.
Well, let me just rephrase this. I'm just trying to say, I think you mentioned it earlier, that Blacks in our community are not taking the test as often as other races in our community. And so with that being said, do you have a way of showing by zip codes how it's affecting our community? We had asked about it once. I know some other states are doing that, and I guess right now we're not. I'm just interested in, after you making that statement, where in our community, those zip codes where there is an increase in the virus.
Yes, ma'am. I'm with you now. I do have 1 week old data on zip codes in Chatham County. I have previously been asked, and I've shared with the mayor, I've been asked not to release those. However, it is being freely released in the metro Atlanta area, and as of the next time I get an updated set, which will either be tomorrow or Wednesday, we will certainly publicize that. It's pretty much, I can tell you, it's all over Chatham County. It's not confined to one place. But I would go back to what I said earlier. We really need to take a closer look, and I just simply don't have the data yet to see how many people we are, the breakdown of the people we're actually testing. I have a feeling that, as I said earlier, that we are oversampling the white population and undersampling, our black population. And if that turns out to, in fact, be true, we need to figure out a way to improve that PDQ.
Okay, so why I was asking that is because if you can narrow it down by zip codes, we as city council members could possibly, kind of beat the pots and, beat the drums.
Yep.
This is happening in our districts, and that's why I was asking about, how it's affecting the zip codes in our area and where they're located in the districts of Savannah, because a lot of people aren't taking this serious. As we as city aldermen, it's incumbent that we put out these fires and let people know in this district there are X amount, and you can get tested, because I know they're all over Savannah giving tests. The other question that I want to ask is there another method other than the nose swab? Because I've heard that that's very painful. Are we doing any other types of testing other than the use of the swab?
Well, that's still the gold standard. You know, what everybody is trying to work on is what's called serum antibody testing. And there are a host of serum antibody tests out there. The problem with most of them is that they're not necessarily very accurate. They will improve, and there's no reason that they can't be made very accurate. You know, we have a very accurate antibody rapid screening test for HIV that works on the same principle.
Okay.
And so they are coming. There are at least, 4 coronaviruses that circulate in humans pretty much all the time. Many of the initial serum antibody tests that were put out there could potentially cross-react with those other coronaviruses. And so if it said you have antibodies to coronavirus, you don't know if it was SARS-CoV-2 or one of the other ones. And they could even be, falsely positive or falsely negative. They just weren't very good tests.
Okay.
As time goes on, that'll get better, and that'll be an easier and quicker, test to perform. But there's one other caveat with that, and that is, let's say you have the most sensitive and specific antibody test that you can possibly create. If it's positive, you've got antibodies to SARS-CoV-2. If it's negative, you don't have antibodies and you've not been exposed. We don't yet know what those antibodies mean. We all hope and we somewhat assume that if you have those antibodies, it means that you are immune to reinfection and you're pretty much good to go. But we don't know that with certainty. Remember SARS, the severe acute respiratory syndrome that preceded this and is its cousin, people did develop immunity to that, but it appeared to disappear after about 2 to 2.5 years. So you would catch it, develop an immune response, be immune for a year or two, but then you could catch it again, so to speak. We don't know what the situation is with SARS-CoV-2. We don't know that you're immune at all, or maybe you're going to have a very robust immune response, and once you've had it and recovered, you won't get it again for 25 years. We simply don't know.
Thank you so much, Alderwoman Wilder Bryant. Alderman Leggett.
I'm here, Alderman Shabazz.
Yes, sir.
How you doing, Dr. Davis? I think Dr. Davis and Mayor Johnson both can probably answer this question. What is the what is the plan now that our numbers are going up for our youth league football teams and sports teams are utilizing the parks, and they are contact in close proximity to each other when they're doing practices and workouts? Are we going to look into having a conversation with the youth leagues?
I'll yield to the city manager. Mr. Manager, he's just smiling right now. There you go. Yeah, well, let me go ahead. Go ahead. You're good.
Okay. Yes, I was looking for the zip code data. I will send that to council within the next 10 minutes. I track that weekly when I received the information from Dr. Davis. It's just that based on his request, I keep the circulation of that data to a minimal because he asked me to keep it confidential. But I will go ahead and circulate it to council since he agreed to do that. As far as youth sports, as well as all summer programs, as you might recall, the city accepted applications last week for the summer camp as well as the summer program. But we did put a caveat in there that we may be advising parents and guardians not to expect those programs depending upon the continued tracking of the data. I mean, that's what I do every morning. I joke with Dr. Davis. It used to be in the morning, the first thing I do is grab a cup of coffee and read the newspaper. But now I look at his COVID report and particularly how it impacts our community. So all I can say is we're we're anticipating resuming those programs, but we are just tracking the data day to day, and we'll make a decision at that point at the last possible minute. But we will not jeopardize the safety of our children nor their parents because of the contact among both the activities as well as within the summer camp programs.
Good, Alderman Leggett.
And the second part of my question is, are we receiving real-time data? Because most of us who work in healthcare, we are seeing the testing go up. Numbers are going up, and I just want to make sure that we're receiving real-time results from the hospitals and the testing sites, and they're not holding back on the numbers, because they are going up.
No, I think the hospitals are doing a good job of reporting, their cases, and we're getting a 24 to 48 hour turnaround on the specimens we submit to our lab in Atlanta now, which is not exactly real time, but it's a whole lot better than 10 or 12 days like it was about 2 months ago. So we're much better than we were before.
Thank you. Thank you. And we do, as the manager says, we receive daily briefings on this, and hence the alarm, because we saw the uptick going on. If there are no questions for Dr. Davis, I wanted to go to, you have a question for Dr. Davis, or? Okay.
Yes.
Alderwoman Shabazz, Alderman Carter.
Thank you, Mayor. Dr. Davis, my question is, and I'm pretty sure that those in the medical industry are doing forecasts on the rest of this year on how things may likely go in our community, in our city. So that's my question. What does the forecast look like? Are we headed to a second bout of this COVID-19 in our city? How does the forecast look? I hear the rising of numbers, but just let us hear what the experts are saying in their forecasting.
If I'm interpreting your question correctly, we are seeing an increased number of positive cases. However, it appears that a significant percentage of those positive cases are in younger individuals who are either completely asymptomatic or relatively asymptomatic. They have mild illness, in other words. And so thus far, at least, our rate of hospitalizations and the rate of ICU admissions and the use of ventilators has not gone up at all. In fact, it's down lower than it was initially, even though our average number of positive cases per day is higher than it's ever been before. So, and I can't really explain that except by saying that, generally it's the younger people, the younger adults who are getting out and about and doing things, and then they hear about a friend or an acquaintance who tested positive, so they think maybe I better go get a test, and they do, and lo and behold, a higher percentage of them are positive, but they're not really very sick. So I wish that I had a crystal ball. I told the mayor before that I do have my Harry Potter wand, but I don't have a crystal ball, and I can't tell you for sure, what's going to happen. I know in some places they are seeing gradual increases in the rates of hospitalization. I was told by my counterpart in Macon, I'm not speaking on their behalf, but I think that they had seen an uptick in hospitalizations south of us in the Glenn County, St. Mary's area. The hospital system had seen a little bit of an uptick, and they were going to have a conversation about making sure they were ready if they actually had a surge. So I don't know for sure what's going to happen, but it does appear that a reasonable percentage of these positive cases are in people who are relatively asymptomatic.
Okay, and go ahead. Yes, sir.
I was going to say, if you read the paper, you'll see that there are one or two people out there saying that maybe the virus is mutating and we're adapting and it's becoming a little bit less serious, but I don't think I would take that to the bank yet. I'm not sure I believe that, but I have read it as recently as today that some people may think that. Again, that concerns me, but y'all wanted an update, so I'm giving you an update.
Okay, in reference to forecasting, and this is my last statement and question, is that as the city manager releases the data per district, I would ask and request that in your planning and forecasting that the first, the third, somewhat of the second and the fifth districts are and especially the fifth district is predominantly African American districts in residence. So in your forecasting, I'm going to ask that if you all can look at doing some planning. Don't know how things are going to turn out and the numbers are going to turn out, but doing some planning for testing. I asked this question of concern maybe about 2.5 months ago about testing, especially in the fifth district, but more as Alderwoman Wilder Bryant and her subject, and I'm just carrying on her statement in reference to planning, forecasting some areas in our districts for testing sites. Thank you so much.
Thank you.
Thank you.
Let me just, and just for clarity, Alderwoman Shabazz, the information that will be released is not based on district. It's based on zip code. And so again, in terms of how the data is aggregated, it has no respect to a particular political district. It is based on the zip code of the residence of the person as where they live. And
yeah, but we can see from the zip codes, we can tell.
Oh, I was going to say, but no, because many districts in the city are actually city, county, or city and another municipality. So I just want to make sure that we're very careful when we look at this data that is qualified by the fact that if it's, for example, 31405, well, we know 31405 goes a big gamut. We know 31401 goes a big gamut. We know when we talk about 31404, 31406, that includes city and county. If it's 31419, that's city and county. So I just want to make sure that we don't have any expectations as it relates to how the data is gathered. It'll just be based on the zip code of the residence of the person living at that particular time.
Yeah, but doing the analysis of the breakdown of the zip codes, then we can see how our outcome will be in our district. So thank you so much.
Thank you. Alderwoman Gibson Carter. And Alderwoman Blakely.
Mr. Mayor, can I make one more comment about the zip codes?
Yes, ma'am. Yes, sir. I'm sorry.
Just remember, when you look at them, that is just that's their residence and may have no bearing on where they contracted the virus. If they're traveling or working, or they can cross one street and be in a different zip code, and so just remember that's where they live. It's not necessarily where they got it.
Well, thank you, Alderwoman Gibson Carter.
Yes, thank you. Thank you so much for your update. I appreciate the time you are taking today. With regard to your presentation and display in terms of where we are today with COVID and the spread of the disease, I would like to acknowledge that less than what people are thinking and saying, there is data out there that supports this whole notion of mutation. I just want to put that out there. And if we delve a little bit deeper, quite possibly there would be a little more acceptance to that fact. Nonetheless, I think the highlight of what you acknowledge related to race and who's being impacted with regard to African Americans and white, I want to acknowledge that there are more individuals within our community outside of the white citizens and African American citizens. And so I would like information related to that. But I think more important than race, although I find it perplexing what has been acknowledged in terms of more focus on white citizens than Black. I don't know how that even started. Nonetheless, I think we should find more interest in understanding who, with regard to the demographic breakdown being our youth, our seniors, and our vulnerable populations. How is this impacting that demographic? Particularly when we start to talk about our nursing homes. I know for a fact that one nursing home is down to 20 patients because of the outbreak in that facility. Further, there has been acknowledgement, and I would just like for you to share some light on this piece related to information I received over the weekend, where an individual indicated that all 1,200 plus beds in our local hospitals is at capacity. And I don't even know the number of bed spaces we have in our community, but I wanted to know if that was in fact true and how you see that playing out in terms of how we respond to our citizens with regard to medical care. And I think that's all I had. I am further perplexed by the fact that we can't do better surveying in terms of who these individuals are with regard to geographic location in our city. I do recognize and can appreciate the fact that for some, it probably doesn't matter where they live or where they acquired it. I think, again, drilling down into this information will allow for us to look at how we are going about in a different way. I know that was a lot, so if I need to repeat anything, just let me know. Thank you.
Well, excuse me, I just had to unmute myself. As far as the hospital beds, we're not at capacity as of the last bed count I have. We're not close to it, and we're not close to the ventilator or ICU capacity. We've still got adequate capacity in the hospitals, in the ICUs, and with ventilators. So I'm not sure where that number came from. Let's see. As far as the zip code data, again, I'm happy from henceforth to share that. We have to do that manually. There's not an automated way, to generate that. So we have to extract that data manually, and we're happy to do so at least on a weekly basis. I do not have access to geocoding, so I can't go in and ascribe it to, a specific location. And I'm not sure I'd want to do that anyway, because that would basically be identifying, who has it. But I'm certainly happy to share it by zip code, and again have done so with some of the elected leadership, for some time now since we were able to get it. And I certainly will be looking at the data that we're now able to get. Heretofore, until the very end of last week, we could only do the ethnicity on those who were positive. We could not determine who was being tested, and so we just have our fixed sites, and we just test whoever shows up. So I don't think anybody has made an attempt to prioritize testing, one way or another. But I do think that this new registration tool will allow us closer to real time to determine, who's being tested, and if in fact it continues to support what the early data looks like. I agree with you and the other couple of people who said something about we need to do a little planning and do a little better, and I'll be the first person to agree with that statement, and we'll certainly do our best to do so.
Alderwoman Miller Blakely.
I'm sorry, Mayor Johnson.
Ma'am?
So I have my other question was related to,
Sure.
with regard to this data, do you know what percentage of youth versus seniors versus other citizens who are vulnerable and those who may be living in nursing homes, because we do know that COVID becomes more dangerous for our senior citizens. So I would like to know if there, with regard to these numbers and the data that you do have, is it the majority youth? Is it middle-aged people? Is it predominantly senior citizens? I know you have the breakdown with regard to Black and white. And in that regard, do we even know how many are Hispanic?
Hang on just a second. We have some of the data as far as 1.74% Asian. We have a very tiny percentage of American Indian Native. We have 5% that's just classified as other, and I don't know exactly what that means. We do know that we have certain long-term care facilities that have had more difficulty than others. And not only we, but some other healthcare organizations in the county attempt to work with nursing homes to make sure they continue to follow best infection control practices. I can tell you that one concern is that sometimes the staff that works in nursing homes and other long-term care facilities works in more than one such facility. They're sometimes not the highest paid individuals, and they're working hard and maybe working 2 jobs, sometimes 3, just to, make ends meet. And so if one of those people becomes infected, they certainly have the potential to spread it not only to nursing home A, but also to nursing home B and or nursing home C. And you're absolutely correct that the older population in our long-term care facilities is at higher risk of an adverse outcome. That's been one of the drivers for hotspots in the state, since the word go. It continues to be true. There are certain things that the nursing homes can do, such as what we call cohorting their patients. Anybody that's positive goes in one hall, so to speak, and anybody who's not goes on another, and they try to cohort the staff so they don't go back and forth between the 2 populations. It just becomes very, very difficult for them being the management and the employees, it takes extraordinary diligence not to potentially infect another resident. And if, in fact, a single resident becomes, newly positive, we consider one resident in a nursing home to be an outbreak. And we recommend that every resident be tested, and we recommend that all of the employees be tested. And we try to help facilitate that. I wish I had an answer for it. I think the answer might be an effective vaccine. And I certainly hope we're able to develop one. Recently, there has been some indication that the percentage of positive tests in children up to age 17 has been rising. Early on, that was a very low rate of positivity. It seems to it's still low, but it's not as low. I don't have a breakdown on those numbers for us in Chatham County. Again, that would be one of those things I would have to do multiple steps manually. And right now, most of the epidemiology effort we have is being put into tracking down each case and doing a case investigation and contact tracing and advising them about quarantine and isolation. So, but any congregate living shelter is potentially a high-risk situation. That would be nursing homes, prisons, any other assisted living type facility. Any of those facilities where people are in close quarters are definitely at high risk.
Alderwoman Blakely.
Thank you, Mayor. Thank you, Doctor, for this report. I only have 2 questions. What is the website where individuals can actually go and see the COVID updates? Can you give me that website right now?
GACHD. GACHD, as in Georgia Coastal Health District, GACHD.org. And I think it's right at the top of the page. Click on COVID.
Thank you. In reference to the confidentiality for the zip codes, the information that we're going to be getting, will we be able to give that to, post that so that people can see it? Or do you still want us to, not say anything about it? Because people are actually concerned about these zip codes and where the individuals are testing positive in their areas.
We will not only send it to you, and I think Pat indicated he's going to go ahead and send out the data from last week. We'll have it on our web page as well so everybody can see it. The
Awesome.
only caveat will be that any zip code that has 5 or fewer cases will either show up as 0 or an asterisk, because that's sort of typical HIPAA guidelines. You don't release data for 5 or fewer in a geographic area. It becomes too easy to identify who the individual might be.
Okay. I just want to say this. Thank you so much for coming and telling us this. And I just want the listening audience, our public, to know that this thing is real. It is real. If they're telling you to do certain things, please do it. I have a friend that lost her husband, family members and what have you. This is nothing to play with. So take what is being said, and I'm speaking to the public right now, take what is said serious, because this is very serious. Mask up. I've been out and about and I see people, they have on masks, and the children, they have children, but they don't even have the children on masks. And that makes absolutely no sense. Maybe you can speak to us actually masking the children, because let the public know what needs to be done as far as masking our children is concerned, please. Thank you.
Yes, ma'am. I think, we all need to wear the mask whenever possible. They do recommend not putting a mask on a child less than 2 years of age. And then people that have asthma or some other significant breathing condition may not be able to tolerate a mask. And in those individuals, I would just say, please practice social distancing to the greatest extent possible.
Thank you. Alderwoman Lanier.
Thank you very much. Thank you, Dr. Davis, for this critical information that you're sharing with us and all the work that you're doing. And taking a quick look at the email that the city manager just sent out with the zip codes, you could assume from this information that the uptick or the increase is following the increase in testing and looking at the zip codes. Now, in the first district, some tests had to be canceled because of the weather, but I've made some calls to the health department inquiring about the increase in testings at some locations in the first district. I've inquired about maybe some mobile testing, maybe the Curtis Cooper van probably come to the neighborhoods at the centers. Some people still have transportation issues. I know the one that occurred in Garden City did happen, and I noticed the increase there. So maybe it is following the testing, and we haven't had as much testing in some of these marginalized, low wealth neighborhoods. So if Dr. Davis, if you do hear that conversation in your office about them working towards some mobile testing, if you could support that, please. I think we could get more people to show up to get tested. If we just, in some of these neighborhoods, if we could make it a little bit more frequent, a little bit more accessible. And that's my point. So thank you very much.
Thank you. I hear you loud and clear.
Thank you. Alderman Palumbo.
Thank you, Mr. Mayor. Dr. Davis, I think personal accountability is absolutely critical. Is the Department of Public Health offering masks for residents or a place to pick them up that you're aware of?
Heretofore, we've been struggling to keep up with enough masks, and other PPE to run our specimen collection kits. We are supposed to be receiving I say large, probably 100,000 maybe masks from the state that can be dispersed, but I don't have them yet. They should be coming in this week. And I can tell you that another problem for us is that the demand for testing has been so high the last couple of days. We've had run our site on Sally Moon. I mean, today they were going to have to cut it off in order to be able to finish. They're going to have to limit new people coming into the queue, so to speak, in order to be able to finish, by closing time. And it is anticipated we may actually run out of specimen collection kits this week. If the demand apparently in Brunswick was just as high as it was here, and we, even though we've been able to get a nice number of kits, if it stays this high, we will flatly run out before this week is over. But back to your question, you're right that personal responsibility is important. People should wear masks. We're going to receive a supply of masks, and we will try to make those available as they become available to us.
Thank you.
Mr. City Manager, just wanted for you to give us an operational update. If Dr. Davis, you just stay on the line long enough, but just give us an operational update of where we are. I know we were in phase 1 and we were looking forward. We were within a day or two of moving to phase 2. Where are we?
So yes, sir. 2 weeks ago, I thought the city would be moving into phase 2 since of our Safer Savannah reopening plan. Because the 14-day rolling average, that's the number that Dr. Davis relates to us every day. But that number hit the benchmark of 6. Once we get to 6, the city had planned to move to phase 2. And so coincidentally, 2 weeks ago, we're at 6, but that was the last of it. The sustained average began its current upward swing and now is 3 times that number. So at best guess, I do not think the city of Savannah will be moving to phase 2. If we're extremely fortunate, maybe the latter part of July, but at this point, the city will remain in phase 1. So what exactly does that mean? Safeguards will remain in place, and all workplaces, as you have probably noticed, temperature checks are required to enter into city facilities. The masks are mandatory in all workplaces, particularly in vehicles by both employees and visitors, and they are very limited visitors. Most are by scheduled appointment only. The observance of social distancing will continue, and in fact, the city has probably completed about 90% of its facilities and worked out social distancing plans. As you know, particularly some of our office, such as the Revenue Office and the Developmental Services Office, social distancing becomes much more difficult because of the number of employees and the limited space. But we've been able to work out a plan to meet the social distancing requirements in the workplace. We still have a couple more buildings to finish, but that should be finished probably by the end of this week. We are continuing our increased sanitization at all facilities. And we're continuing to work in staggered shifts and also continuing the teleworking. We are looking at an off and on the teleworking so that employees that are in the office at least 1 or 2 days of every week. We are continuing the expansion of our air quality standards. That's one of the recommendations that Dr. Davis made to us, so that we are increasing our filtration in each of the buildings by going to the highest possible AC filter, as well as continuing our work on looking at ways to improve the air exchange in to bring more fresh air more frequently in all of the buildings. And we're also continuing our other programs, such as the hand sanitization, all the CDC recommendations that Dr. Davis continues to stress every time we talk to him. So will this affect summer programs? As I related earlier, chances are yes. We are continuing to watch and monitor just day to day. We'll make a decision. We're starting to accept applications, but with the caveat that we might be letting the parents and the guardians know that the summer programs may be canceled if the numbers do not improve.
Thank you, Mr. Manager.
That's the point, Mr. Mayor.
Mr. Attorney, just for purposes, I know council may be aware, but certainly for our listening public, let's talk specifically about the governor's order. Where are we in terms of what the governor has ordered at this point in time? You are muted. You're muted. Oh, there you go.
I'm back. Yeah, so we all know that the governor issued an executive order and has ongoingly continued to issue or reissue new executive orders expanding the scope of what he is allowing and is not allowed. Of course, Mr. Mayor, you issued an emergency declaration early in this process, which was approved by council. And then once the governor issued his executive order, he specifically withdrew local control of a lot of these issues. And his language within his executive orders, I would say, has gotten stronger to prevent, again, any local control of handling of this coronavirus pandemic. Specifically, he has said that no local rule, ordinance, emergency declaration, whatever, can be more or less restrictive than his emergency declaration. We can pass ordinances or emergency declarations that would assist in the facilitation of executive order, but nothing more and nothing less. I will tell you that I've had dozens of conversations with other municipal lawyers around both Chatham County and the state and GMA to talk about what that means. And are there any options to try to do more than what the governor is allowing? And so far, no one has particularly challenged the governor's order on that issue. Now, I don't know that doesn't mean it's coming. I don't know if these numbers continue to rise and we don't see more restrictive action from the governor, that someone won't try to do something to make at least their locality better. But right now, no one's done anything along those lines.
Thank you. Let me just ask. I mean, I think that for us at this really critical period of time, and again, I think that hold on, wait a minute. There we go. The context is extremely important because again, we're worse off now than we were when we started, when we said that it was bad, and now it has gotten worse. We recognize fully that that mask or face coverings does help to be able to slow down at least the transmission of this virus from one person to another. Also, although we see a lot of people doing it, a lot of people are not doing it. My position at this point is that I'm wishing to, at least on an emergency basis, order the mandatory use of face coverings within a public space. And I think that we have the exigent circumstances to demonstrate that this is something that is absolutely necessary based on the other things we cannot control. But in this case, again, as these numbers continue to go up and they're going up all over our community and they're not slowing down, I just refuse to sit by idle and not be able to try to do something to be able to try to slow the spread. So what say you, City Attorney?
I think you have authority to do that.
Well, let's put something together to help make it happen. I just think that we're in some very dangerous times. And I think ultimately we're judged on what we do and what we don't do, and understandably. And I think council understands that given the governor's order, who was explicit in making sure that the rights of municipalities to be able to make those decisions locally were essentially taken away, yet we're still facing the repercussions from what is occurring here. It's just, and again, we're also seeing the infections from people who are who have been deemed, as Dr. Davis would call them, asymptomatic. In other words, they're not showing any symptoms yet. They are still not only carrying it, but they're also spreading it to people who might be vulnerable, people who might have underlying health conditions, who then catch it and then have some other issues regarding that. So, you know, I don't know, it's just when I looked at the jump and out of all of the records, we thought we were supposed to be getting better. And you have states like New York where their cases are going down and cases like up where we're going up. And then just, what was it, Pat, 42 over a 2-day period, Thursday and Friday, which were our two highest since this thing began. It's not getting any better. It's just not. So, Mr. Attorney, when you have the opportunity to meet with me, and let's talk about how that happens, and then counsel will keep you informed kind of how that goes.
Yes, sir.
Alderwoman Gibson Carter.
Mayor Johnson, I totally agree that something has to be done, but in our attempt to make things mandatory for citizens in our free society, I think we should be mindful of some of the pieces related to what the doctor laid out in terms of who wearing a mask may be difficult for. And in your acknowledgement or in your demonstration of what this mandate would look like, Attorney Lovett, I think we need to add language that's consistent with how, in fact, this would be policed, who would be policing masks and who doesn't wear masks, in addition to what are the implications if you are caught without a mask. I think this is a piece where so many dynamics, as it is new, it's fluid, and it's hard to pin down. I would hate for us to make a blanket rule whereby all citizens have to wear masks, and it becomes complicated. We are in a time and space where there's a lot of concern about, who police officers are approaching and how they are approaching them, what constitutes that engagement. And so things are still quite vulnerable and volatile. So as you proceed, I just would like to have consideration be expressed there. And so another question I had, Mayor Johnson, is specific to our local businesses. I know that our governor's decision, a lot is layered in what this looks like financially for the state and for local businesses. As these local businesses have opened and in their best laid plans with Resilient Savannah, in addition to whatever the state has recommended with regard to reopening, they still have employees who are testing positive. And so when those employees test positive, those businesses are having to close again. Now, we would only hope that when that happens, that's the process, but we all know that there's probably a slippery slope for those who just let the employees stay home, like we ourselves have done within the city of Savannah. I don't know that we have closed a department because an employee has tested positive. Is there anything we can offer by way of a recommendation for these businesses who are trying to stay afloat, understanding that unemployment may not be available for them? They may not have received the Small Business Administration assistance loans. What is it that we can offer from a leadership perspective to these businesses, to these local owners, when someone within their establishment tests positive? Is it our position to say you must close? And if that is the decision, how is that monitored?
Well, let me get to the easier part first. It's not the city's decision. The city doesn't mandate anyone to close. And I think that Dr. Davis can probably give a better idea about it. Depends on a variety of factors as it relates to that individual business. So the city hasn't mandated anyone to close because of that. I don't believe the city has any wherewithal to provide any assistance to a business that does close. And so if they're closing, I'm assuming that part of the contact tracing element of the health department's program, that once someone has identified as being positive with coronavirus, there's an extensive contact tracing. Who have you been around? How long you've been around them? When was the time you were around them? And I guess that decision goes from there. Dr. Davis, would you care to elaborate on the contact tracing piece and how businesses are deemed to close or not?
Well, that was exactly my position. My position was to ask for a recommendation for businesses when I know that there have been several businesses who attempted to reopen only to have a staffer test positive. Some of those businesses have decided to just close again, but some have staffers who test positive and they continue on with work as usual for the remaining of the staffers there. So I'm simply asking, is there a recommendation for what the owners should do? I know the city doesn't have any purview of who opens or who closes with regard to the governor's order being in place, but people are looking for guidance as decision-making on our national level, on our state level, and here on our local level is so inconsistent. There's no continuity in that decision-making. So I was asking on this platform, is there a recommendation for those local businesses and those business owners rather?
Dr. Davis?
Yes, sir. We actually do not ask, the ones that we're most involved with that you guys would see would be food service establishment or restaurants. And we have not asked anybody to close. Those that have closed have done so voluntarily, I think just out of an abundance of caution and trying to be good community partners and, let the public know that they're doing everything they can to, protect the paying public. When a restaurant employee tests positive, we, know that, just like with anybody else, we get the report. We contact that employee, we do a case investigation, interview them, find out their close contacts. We will also talk with the facility manager, the restaurant manager, and if we're having difficulty finding out who contacts may be, it is possible that we may share the employee's name with the manager, but then we ask that the manager, not divulge that further, but we would do that purely to be able to find out who the other contacts are and also to help the manager do a risk assessment of his or her facility. And we also provide them with information and guidance as to how to do that. Typically in a restaurant, the person who is a case, who's positive, is asked to self-isolate, and they would be excluded from work. Those who are close contacts of that case, if they are asymptomatic, food service industry is considered essential workforce, and so a contact of a case who is asymptomatic could continue to work if they wear a face mask the entire time they are at work. The facilities that have elected to close typically have encouraged all of their employees to go and have a test. That's potentially a good thing, but we need to understand the limitations of the testing as well. If you found out today that yesterday you were in contact with somebody who's a known case, it would do you no good to go have a test done today because it would be negative. People don't typically develop any symptoms. They average day 4 through day 6 following exposure, but it may be as late as day 14, which is why we have a 14-day quarantine period. And so if you find out that you are a close contact of somebody and you're going to follow self-quarantine and only have one test during that time, I would encourage you to wait till about the 10th or 12th day of the quarantine period and have the test done then. something like 97.5% of people who are going to turn positive will do so by the 10th or 11th day. But if you have the test done 1 or 2 days after exposure, there's an extremely high likelihood it's going to be negative. And so we go over all this with the restaurant managers and with the cases and with the contacts. So I could imagine that there may be a scenario where we would ask somebody to close if there were, a huge outbreak in the facility, but that hasn't happened yet. If we have not mandated that anybody close thus far.
Thank you.
And
then in addition, and I guess Alderman Gibson Carter, I guess my discussion to the city attorney is really we would not make any type of law without really evaluating the consequences, both intended and unintended. So we will be weighing in also with Dr. Davis, also with Chief Mentor and all other affected parties. So yes, thank you for that. So I think this is kind of where we are. I wanted to make sure that you all were informed. I wanted to make sure that you had the best information from the people we get it from. Again, I will tell you that we've been monitoring this daily, receiving information daily. And I promised when we stopped the phone calls before that when the situation changed, we will be back. So this was the information as it is right now. I wanted you to just have it. We wanted our citizens to be very clear about our situation as we understand it. And so we'll kind of keep monitoring it as we go forward. And of course, we're available to answer any questions you have. Again, for us, and I admonish you as well, that we're all hopefully doing what we can to take care of ourselves as well. People expect you to be in the public space, but for us, we have to make sure we're very judicious as it relates to how we do that. So Pat just sneezed, so we're going to evacuate City Hall right now. I mean, yeah, I felt that sneeze all the way over here. But we'll be in touch, and again, as the situation changes, we'll keep you informed. Okay. Anything else? All right, Dr. Davis. Again, we thank you so much again for being our partner. Again, this has not been an easy road for any of us, but I certainly feel better knowing you're on our team, and so I appreciate you for that.
Thank you, sir.
And give our thanks to the men and women of the Coastal Health District as well, because we know you have an awesome squad with you.
Thank you, I sure will, and they are a great group to work with. Thank you.
Thank you, Mr. Monahan, Mr. Lovett, Ms. Fox, thank you all so much. Members of council, thank you. Our IT folks, thank you so much. Alderwoman Blakely.
Mr. Mayor?
Yes, ma'am.
The clerk's office would like to request from you or the city manager a listing of the zip codes also for the alderman and mayor records.
We'll follow the email to you.
Okay, thank you so much.
Mm-hmm.
Mayor Johnson, is there any way that we could actually put up all of the testing sites on the city's website or the city's Facebook page or social media and what have you, so that the public will know where they can go and get tested at?
Yes, ma'am. We do that every week. We do it on a weekly basis. And I've been also announcing we've had churches and other religious organizations stepping up, and we've been announcing those too. We want people to get tested, but on the other side of the testing is the contact tracing part of it. And so we'll continue to push that out. As much information as Dr. Davis can give us, we're willing to get it out, and we'll make sure you have it as well.
Thank you.
All right, ladies and gentlemen, thank you all so much. Bam, bam, this meeting is adjourned.
Thank you.
Thank you.
Mm-hmm.